Good morning, everyone. On behalf of all of us at Ovarian Cancer Research Alliance, welcome. We are so glad you're here. Whether you're joining us from your living room, your office, a local coffee shop, or a friend's couch, thank you for making the time to be a part of this incredible gathering. No matter where you're tuning in from, your presence brings energy, purpose, and connection, and we can't wait to share this inspiring experience with you. This year, we did something new. We're offering the entire conference at no cost to you. Our reasoning is simple. Universally, everyone deserves access to the insights, support, and connections this community offers, no matter their situation. And it worked. More than 1,200 people registered for this year's conference, the most in our history. You come from 47 states and Washington, D.C. within the U.S. and 43 countries around the world, representing a truly global community bound by determination, compassion, and the belief that progress is possible when we work together. We know gynecologic cancers don't recognize borders, and neither do we. OCRA's International Gynecologic Cancer Conference is a 3-day event dedicated to education, support, and connection for anyone impacted by gynecologic cancer. You'll hear from leading experts on what's new and promising in treatment and research, including a spotlight session from Dr. Karen Liu, president of the Society of Gynecologic Oncology, as well as sessions on precision medicine, tumor-agnostic therapies, disparities in hereditary cancer testing, sexual health, nutrition, recurrence, insurance navigation, family communication, and so much more. We're also bringing back our very popular 2-part Ask the Experts panel with opportunities throughout the conference for live Q&A and community connection. This past year has been one of tremendous growth for OCRA. We are proud to have both the Clarity Foundation and the Rifkin Center for Ovarian Cancer Research joining us and providing support to patients, advocating for improved health policies, and funding science in our quest to find cures. Additionally, we formed a global ovarian cancer consortium with 3 outstanding international partners from around the world, and in partnership with Microsoft's AI for Good Lab, this new group launched a $1 million AI Accelerator grant with an additional $1 million in compute support from Microsoft. We've also greatly expanded our support services and launched a global policy center, the Center for Public Policy headquartered in our Washington, D.C. office. And we're introducing something else this year, something big. In the midst of all this, we have been working on something that is, without exaggeration, one of the most important initiatives OCRA has ever launched, the Community Accelerated Research Exchange, or Research Exchange for short. This is not just a new program. It is a bold step forward in how we approach research and who gets to be a part of it. Right now, the research landscape is fragmented. Data is siloed, researchers work in isolation, valuable information often disappears after a study ends, and patients, the very people whose experiences matter most, are too often left on the sidelines. But we're going to change that. The Research Exchange will be a powerful shared ecosystem, connecting patients, researchers, clinicians, and advocates through a single global platform. And at its heart is something we're inviting each of you to join, a secure, consented patient registry. By enrolling, you'll have the opportunity to contribute your own data. Imagine easily consolidating all your medical records from different providers into one dashboard while protecting your privacy and fueling urgently needed research. You'll gain immediate value by receiving personalized educational information and a clinical trial finder that's designed with you in mind, offering automated matching and updates when new trials become available. And picture now being able to understand exactly where your experience fits within the broader community. And finally, envision being able to directly inform the research priorities that matter most to you and your family. The registry will bring together data for tens of thousands of ovarian and endometrial cancer patients and will become the largest dataset in the world for these cancers, providing researchers with the information they need to see patterns, leading to much-needed breakthroughs. For researchers, the exchange will provide access to something they've never had before, a data commons filled with high-quality, AI-ready, robust data sets, an environment to analyze, collaborate, and share insights without waiting months or years for journal publication or to meet serendipitously at an in-person conference. But here's what truly sets this ecosystem apart. We're not just collecting new data. We're breaking down the silos that have trapped the majority of existing research data in inaccessible formats. Using AI-powered tools, we're creating a platform where any researcher can access and analyze comprehensive data sets. We're mapping where data sets live so investigators can simply understand the full landscape of what is currently captured. And we're encouraging collaboration to move at the speed of inspiration. Think about what this means. A graduate student at a small college can now ask questions that previously required massive institutional resources. A patient can explore data about their own condition using natural language queries. A busy clinician can stay current with weekly summaries of the latest research. And research priorities can emerge from the questions that the patient community itself thinks are the most pressing. When patients identify urgent questions, researchers can immediately access the data to explore them. We're also introducing a new system for micro publications, short, immediate research updates that remove traditional bottlenecks and get discoveries into the hands of those who need them faster, including our ovarian and gynecologic cancer patient community. This initiative is about more than data. It's about shifting the culture of research itself. It's about inviting patients to be participants, not just subjects. It's about making sure every valuable piece of information, no matter where it comes from, can contribute to something bigger, fueling innovation and tremendous progress. If you've ever wondered what you can do to make a difference, this is it. Please join the registry. Help us build this platform. Help us turn your lived experiences into progress. Your data could be the key to the next breakthrough, not just for you, but for others around the world and in the next generation. I hope you'll sign up now on OCRA's website to join the waitlist for the groundbreaking patient registry. Be among the first to participate, receive updates, and help revolutionize ovarian and gynecologic cancer research. You can join the waitlist on the homepage of our conference platform or on OCRA's website at ocrahope.org/registry. These last few years have seen rapid innovation in science and technology, and OCRA has been working hard to harness this momentum to foster true collaboration, the kind we know is needed to bring about cures. Our work towards this goal represents a huge leap forward and will bring about an actual revolution in research, a sea change in how we can move science forward faster. This platform will create a living, breathing space for scientists to discover, identify, and analyze huge amounts of data in real time at a global level. This is not just realigning our priorities. This is not just reimagining data without borders. This is revolutionizing research. A patient centered, community driven space designed for the acceleration of sharing breakthroughs, designed for sharing inspiration, designed for sharing hope. We're asking more than how can we accelerate research? We're asking how can we transform the entire experience of confronting cancer for everyone it touches, patients, families, caregivers, and the researchers dedicated to serving them. The technology is ready. The community is ready. We are ready. The time is now. Together, we're not just funding research, we're revolutionizing it. Because when we accelerate discovery, we accelerate hope. Our goal is to foster and grow the collaborations in our community, to create a space that has a vibrant living center made up of everyone involved, from patients to principal investigators. Because when we have a shared hope and that hope becomes action, it transforms lives. None of this conference would be possible without the support of our incredible sponsors, including AstraZeneca, GSK, AbbVie, Corcept, Daiichi Sankyo, Eisai, Genelux, Genmab, Grail, Macrogenics, Merck, Natera, PMV Pharmaceuticals, Regeneron, and Verastem Oncology. We thank these generous partners for their support. But most of all, thank you. Whether you're a patient, survivor, caregiver, researcher, clinician, or advocate, you are the heart of this movement. Your voices, your stories, and your presence give meaning to everything we do. At OCRA, we have always believed in the power of science, but we also believe deeply in the power of community. And when those two forces unite, there is truly nothing we cannot achieve. So welcome to the conference, welcome to a new era, and welcome to the future of gynecologic cancer research. Let's build it together, and let's start now.